This video will provide you with instruction on a procedure for obtaining the ankle brachial index and Doppler waveforms for the diagnosis of peripheral arterial disease. Peripheral arterial disease is a common manifestation of atherosclerosis in this country, affecting 8 to 12 million Americans. This disease, though quite prevalent, is underdiagnosed and undertreated, and as a result, these patients suffer a high risk of cardiovascular events, heart attack, stroke, and death. In addition, this disease is responsible for a significant amount of disability. Detection of peripheral arterial disease is critically important, and there are several well-established therapies used to reduce this risk and treat the disability. The first step is a proper diagnosis. A patient history of intermittent claudication and abnormal pulses in the physical exam alone are insufficient to make a diagnosis of peripheral arterial disease. Therefore, the medical community has turned to the ankle brachial index, which is the non-invasive gold standard for the diagnosis. This video will provide you with instruction on how to perform the ABI as part of a bilateral single-level lower extremity arterial assessment. The LifeDop 250 ABI is the premier handheld Doppler for performing the ankle brachial index, or ABI, exam for the diagnosis of peripheral arterial disease, or PAD. The system includes a bidirectional handheld Doppler and portable high-speed printer. In this section, we'll show how to set up the system and perform the ABI examination, including Doppler waveform acquisition and documentation that is required for reimbursement under CPT 93922, the exam code for the single-level bilateral lower extremity physiologic study. Setting up the system is simple. Remove the Doppler and the printer from their packaging. Plug the coiled cable into both the probe and the Doppler main unit. Press the button to turn the Doppler on and off, and use the slider to adjust the audio volume. The LifeDop 250 ABI printer is supplied with paper already loaded. To turn on the printer, press and hold the printer on-off button for 3 seconds. The printer LED will flash green when the power is on. The printer cable plugs into the side of the Doppler unit and into the side of the printer. Both ends of the cable are the same, and the cable is labeled to show which side of the connector is up. Press the lever gently to unplug the cable. Prepare the patient for the exam by having them take off their shoes and socks.